you arrive at what poundage you're going to choose for your patients? Is that such, what TheraBand, how much resistance? How do we know who to give what weight to? Huh? With the dynamometer? Well, I'll say yes in a sense. We need to know first how strong the patient is before we can choose an appropriate weight. Obviously, if a patient is not able to complete full range of motion against gravity, I'm probably not going to start them off with a 2-pound weight. I might in gravity eliminated, but for the most part, when I think about picking a resistance of weight for a patient, sometimes it's an educated guess, but we also use the rule of thumb that the patient is able to complete 10 repetitions. So ideally, the weight that we choose, we want the patient to be able to complete 10 repetitions, but we also want them to feel a little bit fatigued. So if I give a patient a 1-pound weight and he's like a 5+ normal strength, but for his occupation it might be really suboptimal because he's a construction worker, do you think that 1 pound would be appropriate? I wouldn't think so. I wouldn't think so. He'd probably be able to complete 10 reps and not feel anything. Okay? So we want to use the 10 repetition maximum as our guideline, and we want to make sure that the patient feels some fatigue after completing the repetitions. Any questions?
So you should usually like the first 5 are fine, and then as you're getting towards the end, 8, 9, 10. Got it. They finished it, but they're working hard. So there's a level of effort and a level of fatigue, and that's usually your starting point. So lots of good. So it is kind of educated guess to begin with, and then you start to lock it in a little bit more. Same thing might be if you're using a color TheraBand. You're going to do your muscle test, so you have a general idea that somebody's in the 3+ range. The question is, it yellow versus red? They're next to each other. I can start with yellow, have them do their 10 reps and see, and do my check work. And if that was very simplistic, then I'm going to bump it up to red.
Right. The other thing too is repetitions. 10 repetitions is the ideal number that we shoot for. But when you start going beyond 10 repetitions, you're not necessarily working on strengthening anymore. You're working on what? Endurance, right? So for strengthening, we consider low reps. And when we're doing endurance training, we think of high reps.
For endurance, high rep, low weight.
Yes.
For strength, high weight, low
Low
reps.
reps. Thank you. Yes.
Without a full range of motion, we're not considering resistive.
We are.
We're still.
We might change gravity though. So if somebody's not going through full range of their biceps against gravity, we may put them gravity eliminated with
With
that
that
resistance.
resistance.
Yes.
Or I might have resistance in lower ranges.